Hi, everyone. I'm Stacy. I wanted to come on. I've been wanting to do this for a while. I just really wanted to share my story, my journey with stage 2 breast cancer. I've put on some little shorts and videos, but I wanted to kind of give the whole story um, and just hopefully, if it one person um, makes a difference to would be all worth it to me. But anyway, so this started. Oh, and by the way, my channel is Homemade in Stacy's Kitchen. Once I do this and some more, I may change my channel name, but I also do some cooking videos and baking videos, so that's why it's been named that in the past. And I haven't decided for sure if I'm going to change it or not. And I may still come on and throw some of those in there because that's one thing that's helped me get through, one of many things. Anyway, so uh, last October of 2023 is when this all started. So I went to work, came home that day, and took a shower. Was going to play some games with my daughter, and then took a shower, got out, and something told me to do a self breast exam, which normally nothing tells me to do. I mean, I haven't had an inkling like that before, but it did. So I did. I did an exam, and all of a sudden I felt something in my right breast. And I thought, okay, this doesn't feel right. But then I wasn't sure. So I went to my daughter and I said, do you feel anything? See if you feel something. And she felt, and she says, Mom, I feel it. So I thought, this doesn't feel like anything I've ever felt. And I just had, as soon as I felt it, I just had this feeling inside. It just didn't feel right. I just had this not right feeling inside, um, kind of in the pit of my stomach. And so I, sorry, trying to get the best view. So anyway, so I decided, I went to bed that night and I decided, all right, I'm going to call my doctor in the morning because I've never found this before. And 2 years prior to last summer of 2023, my mom had been diagnosed with breast cancer. So I've been always kind of a little, leery about it and whatnot. So I called the next day, went in and saw my doctor, and he says, well, let's get an ultrasound. He says, I don't think it's anything to be concerned about, but let's just prove us right that I think it's just hormonal changes. You're getting older. A cyst, I don't think it's anything concerning. So I thought, okay, but inside me, I'm thinking that it's not right. But so I went in the next day, had an ultrasound and another mammogram. And what's even crazy about this is one of the things, many things is crazy about this is 9 months prior, so January of 2023, I had my annual routine mammogram completely normal. Didn't feel anything back then. But in the past, I've been told that I have dense breasts. So sometimes very dense, actually. Um, and that can make a difference when you're doing a mammogram and when you're doing self breast exams because it can be harder to differentiate between what's a density and what is a not right spot. So anyway, I went in and I never thought a whole lot of it. I've just been told I had dense breasts, but didn't think much of it. But I went in the next day, had the ultrasound, and they did another diagnostic mammogram. And while they were doing the ultrasound, I thought, I could just tell by the way they were looking at the ultrasound machine. And I kind of looked at it myself. And I had talked to a friend that had had breast cancer and had had an ultrasound and told me what it looked like on the screen when she had her ultrasound. So, and then I did look online a little. And so I looked on there, I thought, this doesn't seem right. And then they said, we need you to come back the next day for a biopsy. So that gave me another thought like, this just isn't right. And I just already had a feeling in the pit of my gut, I just knew that this was going to be cancer. I don't know why, but I just knew. Um, and then, like I said, the way they were talking, and I said, "Can you tell me if this is cancer or not? I just want to know if this is cancer." But of course, they said, "Well, we have to get this read by the radiologist, and then it has to go to your doctor, and so we'll get, as soon as results are back, you'll know something." Okay, so I came back the next day, had my. This was the very beginning of October. Had my biopsy the next day, and there was a radiologist in there, a nurse, the technologist that was helping do the biopsy, and so there was quite a few people in there, and then they came in and they started doing it, and the radiologist kept pointing at the screen and looking at things and saying stuff to the other two ladies, and I thought, I don't like how they're interacting. I just knew. And then I said to the and they took several biopsies, and then I said to him, I said, "Can you tell me if this is cancer? I know you wouldn't have all the details, but can you just tell me if this is cancer or not? I just want to know if this is cancer." And he said, "I can't tell you if it is, but I can't tell you if it's not." And the way he said that and the way he was looking at that screen, I knew 100%. So he said, it shouldn't be too long, a couple days and you get results. Well, a couple days can feel like eternity when you're waiting for results like that, even when you already have a feeling what it's going to be or whatnot. But just the waiting is so difficult. But anyway, I went, and I have this thing on with all my clinics, where it's called My Chart or Patient Portal or whatever. And I can get results a lot of times before the doctors even get them. And I work in the medical field, so that's not always good, but it's not always bad because I can read them. And some of the stuff, a lot of the stuff I can understand, but not all of it because I'm not a doctor, but I do work in the medical field, and I've been in the medical field for 30 plus years. But I knew I'd see my results quicker. So, but anyway, so a couple of days went by. So the biopsy was on. So I saw the doctor on it. I found the lump on Monday, saw the doctor on Tuesday, had the ultrasound and mammogram Wednesday. I had the biopsy on Thursday, and I didn't know anything. I thought I would have, so hoping I'd find out Friday, not have to go the whole weekend, but I didn't. Monday morning, I saw the results, and then it was probably less than an hour after I saw the results, but I saw the results, came across my phone, and I looked at them, and there it was. Invasive ductal carcinoma. And I knew, so I kind of already had myself prepped for the worst, and I was telling myself, and thinking, hoping for the best, but planning for the worst. But when you see those results and you see you see cancer, it just hits you, and you feel so many emotions. You feel scared, you feel confused, you feel angry, you're kind of in denial, but yet you're just feeling so many things at the same time, and you don't even know how to react. And then I actually, I went home and I called my mom, actually, because like I said, she had breast cancer 2 years prior. So I called her and I said, "Okay, now what am I going to do here? What's my next step?" And she said, well, then I got a call after I talked to her. I got a call from the radiologist, and he told me the same thing, what I already knew, what the results came back. And then he said, "You need to make an appointment for a surgery consult to see what you're going to do for as far as surgery, and then find out if you're going to need to have chemo or just radiation, or both chemo and radiation." So my mom recommended me to the place that she went. And so I called there, got an appointment for a surgery consult. And then and that was probably, a little bit later in October, like a week or two later. So I got in pretty fast. So I had my surgery consult, and I had written down a whole bunch of questions going into that, because you're feeling so many things, you're thinking so many things, you have so many emotions. And so I knew if I went into that appointment and I didn't write stuff down, I wasn't going to be able to think of what I wanted to ask and find out and know. So I wrote down a bunch of questions. My husband went with me to that appointment. He doesn't know anything medically, but I wanted another set of ears, which was a good thing because there was a couple things that I missed because there was so much information being thrown at me that he caught that I didn't, even though he doesn't know the first thing about anything medical. But it was just nice having him there, and I wrote down on a notebook, and then he wrote some things on the notebook, and then so I did at first have some stuff written down, and then but anyway, so I went into that consult, and in my mind, I'm thinking, I'm going to have a mastectomy. I'm going to have to get my breast removed. It's going to be a big surgery. So I asked her, and that was one of the questions, and wanted to know what the recovery is. I wanted to know what my chances of survival were, chances of reoccurrence, what stage it was, what grade the tumor was. I had so many questions, and you know, I wanted to know if I had a lumpectomy versus a mastectomy, how long each of those recoveries were going to be, and what the recovery was going to be like. And so I went to that appointment. We got there, asked a bunch of questions, and the surgeon said, definitely, in your case, a lumpectomy. At least there where I went, they don't do mastectomies unless they absolutely have to, because it's a bigger surgery and there's more recovery, and and then there's reconstruction afterwards. And she said, I really feel confident that all you need is a lumpectomy and take out a lymph node and check to see if there's any positive lymph nodes. So I thought, okay. So scheduled my surgery while I was there, and I had surgery in the first 2 weeks in November. I want to say it was like November 15th or something like that. I had surgery, and that went very well. It did turn out then, when they got the pathology results from taking out my tumor and from taking out the lymph node, that I did have a positive lymph node, my main sentinel node. And then they also ran some other tests on my tumor, and a couple of those came back high. And then also, because my mom had breast cancer 2 years prior, but there was no other family history of it before my mom. Not that it's always genetic, but there wasn't. So not my grandmas or aunts, anybody, but there was my mom and then me. So they wanted to send the tumor out and run some other tests on it other than just the pathology that they ran. So they did that, and then they had me do genetic testing, because it was hormone estrogen positive cancer. It was estrogen positive, and as well as my mom's was. So they wanted to see if there was any genetic positive genetic factors. Thank goodness that came back negative, because I have my sister wanted to know that, and for my daughter as she gets older. So that was good. And then but 2 of the results came back high, and I had a positive lymph node. So that's how and at first they thought, before all that it was stage 1, but it ended up to be stage 2A. And my tumor was a grade 3, but my cancer was a stage 2. And then, so after that surgery, and I went back to work I had it on a Wednesday, was off Thursday, Friday, Saturday, Sunday, went back to work Monday, and I felt pretty good. And then next after that, I had to have a consult with the medical oncologist there to find out, okay, do I need chemo, or am I just going to need radiation? What's the treatment plan? So there again, when I went in for her, I made that appointment, or they made that appointment for me there. This place that I went made all my appointments. I didn't have to worry about that. But I went in. So then that was like later November, like right before Thanksgiving. I went in for that consult. And then, and I asked her, I said, giving the results of the tumor and the fact that there was some other tests they ran that came back high, and then I had the positive lymph node, would I have been better off to have a mastectomy? Or do you think it's still, or do you think I made the right choice having a lumpectomy? And she said, absolutely, you made the right choice with a lumpectomy. So that made me feel good there. And then she said, but you do need chemo. And that's why I look the way I do. And I came on this video because I wanted you all to see that cancer is real. And this is what cancer looks like. It takes, I mean, my hair's gone, my eyelashes, eyebrows, everything's all, it's gone. And this is what cancer looks like. This is what cancer does. Cancer's ugly. It sucks. Chemo sucks. But, so I had the consult with her, and then I had to have another surgery, get a port placed in my chest, which I did, to do all my chemo treatments and my lab draws, for a couple reasons. Because number one, I have terrible veins for drawing blood, and they just said it'd be so easy to do the chemo if I had a port. So then I scheduled that surgery. I had that surgery the beginning of December, and then I started my first chemo treatment on December 15th. And I just finished my last chemo treatment this last Friday, December the 3rd. So I'm very happy about that. Yay, I finished chemo. I got through it. It was tough. It was rough. But it was really hard when she said to me, it's 6 months worth of chemo. Well, not quite 6 months. It didn't turn out to be, but close, because I started in December and I didn't finish till May 3rd. Did I say April earlier? If I did. It's chemo brain. But May 3rd. So last Friday, May 3rd was my last one. I got to ring the bell. I got a certificate that showed that I went through and finished all the chemo, which was so exciting to me because it was a tough journey. I had days where I felt great. I had days where I felt absolutely terrible with body aches, with nausea, feeling so tired. I had mouth sores. That was one side effect at times. I've had bloody noses. That was a side effect. I've had many different side effects. And but getting through that, and my first rounds of chemo that started in December, it was every other week, and it was 2 chemo drugs. And then I got 2 anti-nausea medicines in there. And then, I got somebody that I guess wants to say hi. This is one of my loves that's helped me get through all this. And she just had to get in there. But anyway, that's Fiona. And that was every other week. And the day before every treatment, I had labs drawn to make sure they were okay to get my treatment. And that was the worst of the chemo. That's when I felt the worst. I had the worst side effects. Sometimes a really bad taste in my mouth. And there were days that my spirits were good, but then there were days that I was down. But then I would I'd pick myself back up. And the biggest thing because I had such a great support system. I had family, I had coworkers, I had my church family. I had so many people praying for me, thinking about me, and then the fact that I knew that I had God right next to me, holding my hand. Between that and my support system is what got me through this chemo journey, as tough as it was some days. But I also tried to keep as positive as I could. And I just fought one day at a time, took one day at a time and fought one day and then went on to the next. I didn't look too far ahead because that's overwhelming when you go through something like this. But I just took a day at a time, and I had, like I said, I had an amazing support system. I never knew that I would have nearly that many people thinking about me, saying prayers for me. I had people give me gift baskets to help me get through it, like with comfy, cozy things like blankets and cozy socks and candles and, yummy snacks. And I had people send me cards, and I had people at my work, they had all come together and donated money to me to help me with the medical bills. And then they also did a meal train there for a while where they would somebody would come bring a meal each week for our family. And boy, did that help, because I did try to cook a lot through this whole chemo treatments, but some days it wasn't a whole lot. But it was so nice when I got those meals, and all I had to do was a lot of them I just had to throw in the oven and heat them up. I made a lot of soups because soup tasted good, and it was so great the next day. And people were just so kind that way. And every time I talked to people, how are you doing? How are you feeling? And people kept telling me that I was doing so great and I was so strong and I was rocking it. And I was trying, it's easy to get down and to get your spirits down and to feel defeated. And because cancer really sucks. And my daughter kept telling me, Mom, you just have to remember you have to kick cancer's butt. And a lot of things like that, people telling me and telling me to keep fighting and keep strong. And so that's what I did. And it was a long journey of chemo. And but like I said, some days I thought, how am I getting through this? But I did. Um, and like I said, when I got the days that I got down, I wouldn't let myself stay down too long. And I'd tell myself, okay, get it together, girl, pick yourself up. You got to fight this because you got to beat this, and you got to get through all this. So not only that you beat it so that it doesn't come back, and because you want to live for your daughter and for yourself. And so this is what you got to do. And then I would pick myself back up and go on. And I did a lot of busy things. Like I had crossword puzzles and jigsaw puzzles and word searches. And like I said, I did some cooking and some baking. And my daughter would play games with me and we'd watch movies and just lots of stuff where I tried to stay busy. And I worked when I could, but there was days that I couldn't go in. I just felt too crappy and I was too tired. But the days that I went in, that was a great distraction because I work in a pediatric clinic. So working with the kids makes you feel good, and they're so fun and stuff, and they have such an energy that was a great distraction. But just pushed through one day and on to the next. And now here I am. It's May 5th, Cinco de Mayo today. And I have the 17th of this month. I have a consult for my radiation therapy because now I have to do radiation. That'll be 5 days a week for 5 to 6 weeks, give or take a little either way. And that should be a lot easier than chemo, although I may, feel kind of tired from it. It may wear me down. And so that's my next step, is getting through that. And then my doctor wants me, once I finish radiation, to have a hysterectomy and remove at least just my ovaries, just because of the estrogen factor. Any estrogen that I can get rid of, and then I will go on an estrogen blocker pill for a while to keep this from reoccurring and to kill off any estrogen, because that's what fed into this cancer to begin with. So, and that'll increase my chances of long-term survival and of it not recurring and coming back and spreading elsewhere. So, and I just had recently a PET scan that was good. I have a CT scan coming up in June. Thank goodness I have all these dates on my phone, because when you have so many appointments, you can't keep track of all this. I have a calendar on my phone, so I have all my dates of all appointments. So I have that step coming up. And then, so I have those things. And then otherwise, I'm just going to work, keep going. It's almost summer, so this is great. And it was kind of nice that this all happened over the winter when it's harder to be outside, because in the summertime, you want to be outside. Well, it's a lot easier in the winter when it's cold and it's, crummy out. That made it easier dealing with this. And so, not saying that it was easy, but that made a difference. And now, going forward, because of the type of cancer, the fact that one big thing, and I've done a lot of research now, is the fact that I had those dense breasts, like I was saying earlier. That really can make a difference. And going forward, not only will I have a mammogram every year, I will have an ultrasound every year. So, because there's things the ultrasound can catch that the mammogram can't. And my oncologist thinks that maybe back in January of 23, 9 months, 10 months earlier, when I had my routine mammogram, if I would have had an ultrasound, they might have picked up that cancer then, and I might not have had to go through this chemo and all this that I'm doing. But it is what it is. And so, um, yeah, and so I will do that. And if there's things that I can say that I've learned from this, it's not to take anything for granted, not to sweat the small things, and just how easily and how quickly things can change, how quickly your life can be turned upside down, how one day you're fine and the next day you find this lump and it turns out to be cancer. Not expecting, um, but just to enjoy every minute of life to the fullest because it can change so quickly. And I'm a person that has very, very high anxiety, but I've learned to not get so anxious about things and to just not take things for granted, be thankful and grateful for what I have, and just go with it, and not, like I said, not sweat the small things, the things that I have no control of. I would have got so worked up about before, and now I'm just kind of letting them fall off my back and be like, whatever, because I can't change them anyway. And life is short and stuff changes. And so um, I've learned that. But if there's one thing I can say to people out there, if you don't regularly do it, and I'm not trying to preach or anything like that, it's just a takeaway from me from this whole experience, this whole journey. Please always do your self breast exams. It takes 2 seconds to do. If I wouldn't have done that, I wouldn't have felt that. And who knows where I'd be now. Go have your mammograms. If you have dense breasts, talk to your doctor and tell them, I want ultrasounds, because they could catch it way earlier and you might not have to go through everything that I've gone through. Because my mom caught hers a lot earlier and it was stage 1, and all she had to do was 5 rounds of radiation and that was it. So if I can say that, just please do that. Because if there's even one person I can prevent from having to go through this, it would be all worth it for me. It was so worth it, because it is hard. It is difficult. And it's not just difficult on yourself. It affects your whole family. It affects everything of your daily life. It affects how you do everything. It affects everything. It affects your sleep, your activities, even your normal stuff that you do at home, your work, whatever it is. It affects your relationships with your family and friends and coworkers. I mean, it just changes so much. And you don't realize it till you go through it. And it's okay sometimes if you're feeling down to have a cry and let it out. I did it, and then pick yourself back up. It's okay to, you know, it's okay to feel confused, feel angry, feel, frustrated, feel all these emotions. It's okay and it's normal when you go through something like this. And then for me, just saying prayers and getting as much information as I could so I totally understood what I was dealing with really helped a lot of those feelings and emotions that I went through, because then it made more sense. It made me know that, okay, this is what I'm going to do. This is what's going to happen when I do this. And two, before I started chemo, when I had my chemo consult, and I have a bin of them sitting in my bathroom. It looked like I had a walk-in pharmacy on my bathroom, because you don't know what side effects you're going to have. So, one of the biggest, I think, side effects, especially of the first, when you get the 2 chemo drugs, is either constipation or diarrhea. So you get stuff for both, because you don't know what you're going to experience, or if you're going to experience either, both. And they prescribe you. I had 4 different nausea medicines that I took at home. The sleep medicines, because it's hard to sleep sometimes. If like a Benadryl or one of those over-the-counter sleep can be, because and sometimes your brain is going, so it makes it hard to go to sleep. I have so many, stuff to put in your nose to keep your nose from getting dry so it's not bloody, and nasal sprays, and my eyes got dry, so I got different eye drops, and I can't even, there's so many that I got, and different good creams and lotions, because after you have that surgery, you really want to keep that area nice, and you don't want it to get dry. You want to keep it soft, and and you want to have good lotions for that, and they tell you that. And another good thing to put on that area as it's healing is Aquaphor. Plus, I used it on my nose. That's a great another one to have. I mean, there were so many things I had to have. I didn't know if I was going to need them, if I wasn't going to need them, but I wanted to get them and have them on hand because you don't know what side effects you're going to have. So you go and get all that, and it can be overwhelming. It can be so overwhelming, and it can just kind of make your head feel like you're spinning. But you want to be prepared for anything and everything that could happen. Prepare for the worst, but hope for the best. And so I did, and and each side effect that you get, some are worse than others, some aren't as bad. You just take them and deal with them too. And I made sure I had, like ibuprofen, Tylenol, because you can get body aches, you can get joint pain, stuff like that. And so you just want to make sure you're covered all the way around. And you want to have, get easy foods to eat that are easy on your stomach, and easy beverages to drink that are easy on your stomach, and that kind of stuff. And so it's a whole process, and it's hard to go through, and it's hard to, prepare, but you do, and you finally decide, okay, this is what I got to do. This is how I'm going to do it. I'm going to fight this. I'm going to get everything that I need. I'm going to be prepared. And then whatever happens, it happens. And I'm going to take it as it comes. You learn to, and I've also learned too, to really listen to my body, to be good and to my body and take care of my body. And I'll be the first to admit, I wasn't always the best at that. And I've listened to my body. If I need to take a nap, I take a nap. If I'm feeling really nauseous and it doesn't go away, I take a nausea pill, if I'm hungry, because I feel like my nausea was worse when I had an empty stomach, I would keep a little in my stomach periodically throughout the day. Whatever it was, I listened to my body and I did what my body was telling me. And, I just kind of, took care of myself. Like people would tell me, be good to yourself. Be good to yourself. Listen to what your body's saying and just take care of it. And I did. And I hope for anybody else that's had to go through a journey like this, any kind of cancer journey, whether it's breast cancer or any other cancer, I know what it's like. I may not have had the same side effects that you've had, or you might not have had the same side effects that I've had, or, the same experience, the same stage, whatever. But I know what it's like. And there's a lot of times you feel just downright scared, and that's okay. And then you feel better, but it's okay. And, and two, I've put some videos out there already, some shorts, and I've had lots of people or quite a few people that have watched my videos, and I've had some comments, and I so appreciate that. That makes you feel good, and that makes it a little better too. And it just, every little bit helps, and I hope any of you that are going through this have a good support system. That makes a huge difference. And there's support groups out there. Reach to those, especially if you don't have a good support system. Reach to anybody that you can. If there's anybody that would ever want to reach to me, put a comment down in there. I would love to, message back and forth and give you, I would listen to anybody. After going through this, I would be there to listen. Even if I don't say anything and I just listen and let you talk, I would love to do it. I would love to be a help to anybody in any way if it's ever possible. Maybe it's not, I don't know. But, and it was hard too when I first started going through chemo. I keep kind of stepping back and then going back and forth. I'm kind of all over the place, and I apologize for that, guys. But I had myself prepared. I bought myself little head wraps, and I I bought, and then I got a whole bunch of N95 masks. I ordered online because like I said, I work in a pediatric clinic, and of course, I was going to be going through this through flu and cold season, and I didn't want to be getting. I knew that my blood counts would start to drop, and I knew that I wouldn't be able to fight stuff off well. And so, if I could help at all to not get stuff, I wanted to do that. So I ordered. Let me look right here. Things like these things, they've become kind of my friend. I'll put this one on and just show you. Oops. There we go, just like that. So yeah, just like that. And I've worn those like that. And I have other ones too. They're all different and different color masks. So that made it, a little bit more interesting if you have to do once you lose your hair. And I lost the hair on my head before I lost my eyebrows and eyelashes. So when that first fell out, I thought, okay. And that's a shock when that first falls out. I had myself thinking, oh, it's just hair. It's going to grow back. Well, once it fell out, it started falling out in clumps, so that I ended up having my daughter help me shave it off because I didn't want the clumps of hair all over, and I thought it'd be more traumatic for her. So I shaved it off. But then I still had eyebrows and eyelashes. So I thought, okay, I can't fix my hair. I'm going to do my makeup nice every day. And that'll help. And it did for the longest time. It was great because I had, my eyes done, and I could still put mascara on my eyelashes. And even though I didn't have any hair to fix, and then I would put my hair thing on top and my mask to go to work or whatever. But then eventually my eyelashes and eyebrows fell out. So then that made it harder because, okay, you can put stuff on your eyes. You could still put, eyeshadow, eyeliner, or whatever. But then you don't have any mascara. So that's kind of an odd look when you're, you can't do that. And then I thought about getting false eyelashes. I thought about getting a wig. But I thought, no. This, I don't need to do all that. This is how I am right now. If people can accept that, well, that's their deal. It's not mine. This is, and I'm not going to feel ashamed. I'm not going to feel embarrassed. I don't usually go out without something on my head, though, because that makes me feel a little self-conscious. But otherwise, this is it, but now my hair is starting to grow back a little bit. Probably can't tell on here. Nothing with my eyelashes and eyebrows, but it'll come too. But it's starting to grow, and just seeing that little tiny bit, it's not much, but it's a little tiny bit. It's something. It's better than nothing. And there's so many things like that give you hope. And that's the thing you have to hold on to, is you have to hold on to hope, have faith that you're going to get through this, and stay strong. And those are the three big things. If I can say, have faith, stay strong, and have hope. And if you do that, I feel like you could get through it, like I said, it's been tough. I'm through the worst of it, and I'm so happy. So now I'm done with that step. Now I'm on to the next, and I'm taking that as it comes, and then I'll take my next step. I should have started way back when and journeyed from the beginning, when you could have seen me with hair and then without. But I had so many different things that I was trying to figure out. I had so many appointments. I wasn't sure how to do this, about going on like this and do this. And so I guess better late than never. But I've wanted to do this for a long time. I'm going to keep coming on frequently with little videos or shorts or whatever, and just give you updates. Right now, I'm okay. I'm doing okay. It's Sunday. Like I said, I had my last chemo Friday. I'm feeling pretty good, just tired today. I'm a little bit nauseous, but overall, I'm feeling pretty good. I felt great yesterday. And so I'll see how I feel tomorrow, then I'll go on to the next day. But I thank you already for all the subscribers I have so far. I thank you for everyone that's viewed my videos, whether it's these cancer ones or the cooking ones that I put on previous, and all the likes, the comments. I so appreciate it. And I hope that you'll subscribe. I hope that you'll like my video at my live here and give me a thumbs up. And I hope more people will watch this. And I hope, like I said, I hope it makes a difference in one person. If it just does one and that's it, it'll be all worth it to me, and it'll make me feel great. Um, and so I hope that you guys get something out of this. I'm sorry if I rambled because I've never done this before. But I thank you for listening. I thank you for watching. And I hope you all have a great Sunday, a great Cinco de Mayo. And it's beautiful weather here where I live in Minnesota. That's all I'll say. I just live in Minnesota, but it's beautiful weather today. The sun is shining and it's nice out. I hope wherever you are, it's a nice day and you can enjoy your day. And I will catch you guys soon. Thank you guys. Love you. Bye.